welcome all attendees to my knowledge, the first International Virtual Cataract Appropriateness and Prioritization Symposium. We are delighted to host this. It's been a pleasure to organize. We've learned a lot during the way. We hope this can be not only a venue where knowledge can be shared, but it can really be a starting point for these important discussions as we move forward in the setting of scarce resources. I think all countries to a certain extent have this issue. We definitely have this issue in Canada. And the goal here is a talk on the health services issues. We spend a lot of time as clinicians in ophthalmology quibbling about the best way to make a capsulorhexis. Now that's important as well, but just as important is making sure that we deliver appropriate care to the patients who need it most, and also to make sure that we can advocate for those who cannot advocate for themselves. And I think particularly in Canada, but also in other countries, equity is important to us as well as we strive to do this. So access for everyone. And then again, making sure that everyone has an equal opportunity to share in this care. And I think that we can make great strides in this area. You're going to see there's going to be some short talks on some of this because there's just not a lot of research, unfortunately, and there's going to be a lot of ambiguous questions. If you're here thinking that you're going to see a bunch of neat RCTs that are going to give you an easy answer, this is unfortunately not the place. This is not unlike, think of your most nuanced clinical scenarios. This is in the mud, in the trenches, do it using observational studies design, non-traditional methods, really trying to study very difficult questions where political changes affect things, funding changes affect things. You have to balance the new thing we're trying to balance is incorporating the patient as well. I shouldn't say new, but I should say something that we've maybe not done very well in the past. We're trying to take all of these different things and put them together in a cohesive way that can hopefully be reasonably universal across many health systems. Even in Canada, we talk about Canada as a whole. Well, every province has their own platform, funding system, political situation, and even there, across provinces, it can be difficult to come up with universal principles. But I think that's the goal here. I am first just want to say I'm indebted to the team behind the scenes. This started as an idea. Some of the panelists here are really the inspiration for it. And CHR was kind enough to fund us to get this started as well, which we are grateful for. And we have one of our research fellows, Diana Martinez, who behind the scenes has really just led this and done an amazing job. Her with Mike Yang, who's not on the panel right now, Daniel, we have some other medical students I'll introduce later, have really worked hard, and Diana, as the first talk, is going to go through some of the process where we really want to look at what's out there, try to find the right people, and try to bring as much together so that we can use it as a starting point for next steps. So a special thank you to them. I also just want to let a few other people speak before we get into our formal symposium. We're gonna start with Ike. I think Ike needs no introduction. He's been around for a long time, and he's always believed in me to help me to do this research. And he's been a strong advocate for me to work on something that I like to do and that I thought was important. And I really appreciate his support through all of this. And as we know, Ike is busy in many areas. Now he's taken on a very big position in Utah as well, in addition to all of his roles at University of Toronto, at Trillium, in Ontario, in addition to a heavy clinical and surgical load. So thank you so much, Ike. Why don't you say a few words here, and then I'll introduce Sharif.
Well, thank you so much, Matt, for your kind words, and congratulations to you, Matt, for all the hard work you've done. You've been such a shining star at the university and at Trillium and in our city, providing evidence and guiding us to make the right decisions. This topic is such an important topic. And as you said, we often talk about the how to do surgery and probably not enough about the why. And so much of what we do in medicine is about choosing wisely, operating on the right patient with the right procedure at the right time, and using the principles, of course, of ethics and justice and do no harm and doing the right thing. And I hope this guides us in this manner. I echo your thanks to Diana. I know she's done tireless work for this, and all the panelists and all the speakers that have done so much work to prepare for this. I thank our chair Sharif for all his leadership and his support in this endeavor as well, and others as well. And Rob, of course, who's been a pillar at the IBH, Institute for Better Health, to really kind of push forward this idea, support the program. This is an area that I think most will see probably does require a lot more research, a lot more discussion, and probably hasn't had the limelight that it should. And I hope this type of event will encourage us all to think about these important aspects of caring for our patients. So thank you. I look forward to the spirited discussion. We have a great international cast of speakers here. I see people here already on the participant list representing a wide group of clinicians and surgeons. And thanks again, everyone, for attending.
Thank you, Ike. So Sharif, if you want to say a few words as well, Sharif as well has been doing this for many years. He's been an ophthalmology trainee. He's been a trainer, as a program director. He's also had many department and political leadership positions where he has tried to really improve access to care, prioritization, everything about ophthalmology. And he's always had such a can-do attitude anytime I've wanted to do research as well, just saying, we can do it, you can do it, let me help here, let me help there. And I'm indebted for what he's done as our department chair. He's finishing up his term here. Basically, again, just saying, you can do it, we can do it, let's do more. Always having that attitude related to research. Go ahead, Sharif.
Thanks very much, Matt. And I got to say a big congratulations to you for putting together this symposium. This is so timely, and it's so nice to see this topic addressed. We know that this surgery is the most commonly done surgery in ophthalmology in all of medicine, but we just don't spend enough time talking about the parameters, about the appropriateness and prioritization for this. I know how passionate you are about the topic, and it's been wonderful to see you address this, try to drive policy, try to drive our understanding of the issues, and come out with appropriate guidelines. And of course, I have to thank Rob Reed and Ike Ahmed for the support they've given for this conference and for all the research that has happened. I also want to thank Diana. Diana, you've done a great job, and Daniel, in putting together this. This has taken a lot of work, and you've done a great job behind the scenes. And of course, our panel, we have some experts from around the country, and Dr. Pesudovs is joining us from Australia. I think it's almost midnight where he is, and he's kindly agreed to be here. So I'm really looking forward to this meeting as well, and congratulations to all. Thanks.
Great. And then I'll just introduce Rob as well. So Rob is the Hazel McAllen Research Chair in Learning Health Systems at the Institute for Better Health, and really onboarded me to be a clinician scientist at the Institute for Better Health, which is focused on health services research. There's not a lot of basic science research going on there. They are focusing on these types of issues, and they took a chance on allowing an eye doctor, some people call us eye dentists, an eye dentist into their fold. And it's really been fantastic learning, seeing the environment, watching it grow. So kudos to Rob for his support on helping us do this, helping us through the CHR granting process and all the institutional backing that we've had for that.
Thank you so much, Matt, and just echoing Ike and Sharif about congratulations on just this terrific event, and to all the cast, including Diana behind the scenes that have been working so hard on it. I want to welcome everybody on behalf of Trillium Health Partners, which is a very large hospital in the Toronto area. It serves about over 1 million people every day walking through our doors, and eye care and the delivery of cataract surgery couldn't be one of the most important things in serving the health of the people of our area. And this line of research is incredibly important to the population that we serve. So I just terrifically excited about the day and tomorrow to listen and learn. And I also really wanted to say thank you to the partnership for the hospital with both Prism Eye Institute and Ike, and to the University of Toronto, the Department of Ophthalmology, Temerity Faculty of Medicine, the partnership between the hospital and Prism and the university has just been terrific over several years. Lastly, I just also wanted to express the deep gratitude to the funders, particularly the Canadian Institutes for Health Research, but also other funders in our community that are philanthropic and our government sponsors for this work. So thanks to everybody. I just can't, I'm just on edge waiting for the rest of the day.
Great, thank you.